1. The gammaCore Sapphire CV, a non-invasive vagus nerve stimulator, VNS, can increase airflow in COVID-19 patients. 2. The device has earned emergency use authorization from the FDA. 3. It may also reduce the inflammatory cytokine storm associated with COVID-19. Marshall Better, MD, FRCPC, was isolated in a hospital room with COVID-19 when he received the call in August. It was Peter Staats, MD, a fellow clinician scientist and an old colleague, calling to check in. Staats had no idea that Better was infected with the virus, or that he was struggling with severe shortness of breath despite receiving oxygen, steroids, and antivirals. So it was pure coincidence that a treatment Staats co-invented, gammaCore Sapphire CV, had just received Emergency Use Authorization, EUA, from the Food and Drug Administration, FDA, to treat patients with COVID-19 and reduced airflow. Staats mailed his friend a device immediately. The next day, Better took the small, handheld vagus nerve stimulator, VNS, and placed it on his neck. He stared at the pulse oximeter on his finger, its blinking numbers revealing a blood oxygen level of 91, quite a low number given the amount of supplemental oxygen he was receiving. He says he watched in awe as that number rose to 95 within minutes. For the first time since his diagnosis, Better was able to breathe. 3 days later, he was discharged from the hospital. Normal oxygen saturation levels range between 95% and 100%. Better credits the device with saving his life. When you go into the hospital and they tell you've got bilateral COVID pneumonia, and they put you on oxygen, and nothing is helping, it's very worrying. Better, a clinical associate professor at the Medical College of Georgia, tells very well. I think gammaCore was a very important part of my success in recovering from COVID. Not only did it make me feel better, but watching my stats go up like that gave me great hope and was just mind-blowing. It completely relieved my anxiety. The gammaCore Sapphire CV was granted EUA in July for patients with suspected or confirmed COVID-19 who have asthma-related dyspnea, shortness of breath, and decreased airflow. It can be used at home or in a healthcare setting. However, the benefits of vagus nerve stimulation can extend far beyond the breath, and far beyond the acute phase of COVID-19. Research shows that VNS treatment can affect almost every organ, potentially easing more systemic and/or long-term COVID-19 symptoms.